Good evening and welcome to this webinar about infection control and winter planning. My name's Hannah Morgan. I'm the Head of Operations here at the Good Care Group, and I'm joined this evening by Emma Sadler, Head of Quality Assurance. This evening, during this webinar, we're going to give you a brief introduction of who we are at the Good Care Group, and to give you an overview of the conditions we care for and a bit of information about how live-in care works. We'll also be discussing how we are preparing for winter and why this year more than ever it's all the more important to prepare for winter. We'll also be issuing you some guidance for you and your loved ones in relation to keeping infection-free and as safe as possible this winter. So just a little housekeeping prior to getting started. You are all muted and we cannot see any of your cameras. The session is being recorded and we will distribute the recording to all attendees in the next couple of days. And of course, we'd love to take any questions from you. So please do use the question function on your toolbar, and we'll make sure we've got plenty of time at the end to answer any questions you might have. So without further ado, I will hand over to Emma.
So about us at the Good Care Group. So we are an award-winning live-in care provider. We provide care to people in their own homes across England and Scotland. So our clients are predominantly older, and whilst they're living with a range of conditions, about 60% of our clients have a diagnosis of dementia. In April of last year, 2019, we were awarded an outstanding rating from the CQC, which is our regulator, the Care Quality Commission, and we achieved outstanding in all 5 inspection categories. So we're really proud to say that we're the only dedicated live-in care provider to have attained this rating. And for those of you unfamiliar, live-in care literally means that we provide professional carers who are matched to the individual client, who move into the property, staying in the spare bedroom and providing round-the-clock care and support for the person in their own home environment. So how that works is carers are allocated to work with an individual client on a rotation. So for example, you'd have a team of 2 carers, one may work for 2 weeks, they go off for 2 weeks whilst their carer colleague replaces them. So they work 2 weeks on, 2 weeks off on rotation. So the person becomes familiar and comfortable with one small team of carers. During the pandemic, this has obviously meant that we've been able to minimise footfall in clients' homes because carers, in effect, isolate and live with their clients. So it's unlike in care homes where, unfortunately, we've seen really high rates of COVID because they have so many people coming and going in a day. We're also a fully managed service, which means that we take care of almost all of the administration. For example, if a carer assigned to you or your loved one was unwell, we'd be responsible for providing backup and alternative carer. We'd also cover holiday. We arrange the carer's tax, national insurance, and provide you with one point of contact for liaison. So you have a dedicated care manager looking after you and your loved one. We also have rigorous recruitment processes. We only employ around 2% of carer candidates who apply to work for us, and we provide extensive in-house training. And whilst we specialise in elderly care, and support most conditions that older populations tend to be living with, we can also support adults of any age depending on their condition. So these are the sorts of conditions that we care for, although it's not an exhaustive list. We're also specialists in dementia care. However, our team have specialisms in multiple areas, such as Parkinson's care, palliative care, and care for those who are generally frail. Our services can be delivered as respite, which is short-term care delivered in blocks of weeks of anywhere between 2 to 8 weeks. Or care can be as an ongoing arrangement. Within an ongoing arrangement, there are different levels of support. So our standard package of support we refer to as care and support. We can also support couples, which we refer to as couples care. And this can be cost effective, particularly if comparing it to 2 care home places where you would pay for an individual place. And it enables couples to stay together in their home environment. We have palliative or end-of-life care, which enables clients to stay at home with their memories and loved ones until the very end of their life. We have nurse-led care for more complex conditions and situations, and this care is overseen by our consultant Admiral nurse, who specialises in support for families of someone living with dementia. And we have our OT-led care, which is overseen by our in-house occupational therapist. OT-led care may be for someone recovering from an operation, for someone who needs help arranging a hospital discharge following a change in need, such as a hip fracture, or for someone who's at risk of frequent falls or who requires support with home adaptations.
I'm going to talk to you a little bit now around why it is that we prepare for winter every year, without wanting to fearmonger, of course. So just to talk you through a little bit around what that process looks like. So at the Good Care Group, we are acutely aware that every single winter we're approaching a more challenging season for our clients. We aim to put as many measures in place as possible to support our carers, colleagues and clients stay safe and well in these more challenging conditions. We usually start planning for winter in summer, which seems maybe a little premature. However, we need to make sure that we've put in place kind of robust communication plans and as many proactive measures as possible in order for us to be prepared for the changing seasons. This year, of course, we're looking at our usual winter challenges with the added complexity of a global pandemic, obviously with coronavirus at the moment. So just to provide a little context around why winter can be so challenging. The pressures on the health and social care systems generally peak in winter every year. So the system typically operates at maximum capacity throughout November through to February. In recent years, hospital bed occupancy rates have regularly exceeded 95% across the UK, and you'll all be aware in the news, obviously, around the concerns around that on top of the coronavirus hospital admissions. So at the Good Care Group, our aim is always to keep people infection-free and out of hospital as far as possible. So from experience, and I'm sure many of you on this webinar will have heard stories of people talking about their loved one saying, you know, mum just hasn't been the same since her last chest infection on a hospital stay. She just, you know, she's not really been able to bounce back. And that is because, you know, the more vulnerable clients do not have the same resilience and therefore are not able to return to the same baseline as they had been before a hospital admission or an infection. So prevention is more important than ever at the moment. And obviously we want to make sure we're keeping people out of hospital and easing the strain on the NHS as much as possible, because we know the outcomes for our clients are significantly better if we can keep them out of hospital. Flu always has a large impact on older populations. And this year it's likely to be exacerbated by COVID-19. So it is possible to get COVID and the flu at once. And as you know, both viruses favour indoor environments, so poorly ventilated homes. And we know when it gets cold, people close the windows in winter and are going to be spreading the viruses are going to be spread more easily in people in closer proximity, potentially coughing and sneezing in a poorly ventilated house. It seems obvious to say, but cold temperatures also form a large risk factor for falls, as people tend to fall on icy surfaces. It might decrease circulation, which again can have an impact on mobility. And we know that emergency admissions in hospital spike when temperatures fall below 1 degree, which we often see every year. All that we've outlined, and one other thing to mention just whilst I'm going through the stats is, in normal circumstances, so kind of pre-COVID, the colder weather has quite a significant impact on older populations, as we know. So for every 1 degree Celsius, the temperature drops below 5 degrees. Respiratory infections increase by 10 to 20%. And with that, hospital admissions increase by 1%. So, you know, kind of 2-3 degrees below that, we're talking kind of 30 to 60% increase in infection rates. So it's really, really important that we get as prepared as possible. So obviously we've outlined the pressures that we face every winter. This winter, obviously, we've got the added pressure of COVID. So there is a high degree of uncertainty around how this epidemic will evolve in the coming months, and obviously what we should expect. But we need to prepare for continued peaks in transmission rates and local lockdowns, which obviously we know are happening as we speak. We know that any extremes of heat cause issues for our clients. So the summer months come with other issues. However, in terms of health and the impact on the NHS in terms of capacity and our workforce in terms of absence levels, winter is obviously a really, really important time for us. The implications of these additional challenges are likely to be on our workforce as well as our client base. So as well as having, potential client illness, we know that everybody is more at risk of getting unwell in winter. So it's likely that we're looking at higher rates of staff sickness, and extreme weather conditions obviously can potentially cause travel disruption. And we're very aware that staff burnout is a real possibility, particularly on the back of these long months of COVID that we've already been supporting our clients throughout. So lots of our carers have been working longer shifts than normal, unable to get home as easily. So Emma is going to discuss slightly further on our approach to the workforce management, but just wanted to highlight a few of the issues about how winter normally is in terms of challenges and why really now we're getting as prepared as possible. So I wanted to talk a little bit about winter plans and our COVID-19 precautions. So it is and has been our main focus for the last kind of, I suppose, 8 months or so now, very much how we can keep our clients, colleagues and each other safe. A lot of that is down to good infection control. So I can't emphasize enough, and I know we've got this poster up here, the importance of good hand hygiene and good respiratory hygiene. So I'm sure you've heard it before, but to reiterate, the importance of washing your hands, with warm soapy water as often as you possibly can, and good respiratory hygiene. So obviously coughing into a tissue, for example. We make sure that all of our carers are well informed about any updates to policy, any updates to PPE provision. We keep in touch with our carers on a very regular basis. So we have a weekly bulletin that we send out to our care team, which includes any updates. We also send ad hoc comms if there's been a significant change, and we'll send the same to the client so everybody knows if there's been any updates at all. We also have our online carer community, where there are social forums specifically around the coronavirus, travel, staying well emotionally and physically, where we can share resources, information and updates, even videos, for example, and updated policies to make sure that everybody is aware of their part and how they can help prevent any transmission. So we know that when a carer arrives at a client's home, that can be a bit of a nerve-wracking time for our clients. Obviously, it's potentially somebody new to the home. They might have been traveling on a train, for example. So what we try and do is make sure that we take as many precautions as possible to keep that section of the handover safe. So obviously, it's obligatory for everybody to wear masks on public transport and in public places. What we do ask the carers to do is, before they greet the client when they arrive in their home, is to go upstairs and ensure they have a full change of clothes, wash their hands, and put on a mask if required. That's really important because we know that the coronavirus can stay on the fabric of people's clothes and on hard surfaces for a length of time. So before even meeting our clients, the carer would go and make sure that they would change their clothing. We also ask that whilst conducting a handover, so between the outgoing carer and the incoming carer, that the social distance is maintained throughout, in line with precautions. And obviously we are overly cautious. I'm sure you can understand why.
We do offer enhanced PPE, which includes IIR surgical masks. That's a specific specification of mask, which is kind of recommended for health and social care. And that's because of the filtration rate is very, very high. So in certain situations where that's appropriate and applicable, we would make sure that the carer has sufficient stocks at all times. That's particularly important with our clients who would be considered in the extremely vulnerable category. We also make sure that we maintain strong infection control practices, so washing the carer laundry separate with the client laundry, regularly cleaning and disinfecting any surfaces, and making sure that the house is well ventilated, because as discussed before, you know, it really favours indoor kind of stuffier environments. We do also have in place very robust absence management procedures. So and I know many of you might have questions about what would happen if a carer had coronavirus, for example. We do have kind of quite sophisticated systems in place to make sure that everybody required is alerted as soon as possible, and we can manage those systems, manage that handover safely. And as discussed before, I'm sure many of you have heard back at the very beginning of this pandemic how difficult it was to obtain the appropriate PPE, so gloves, masks, aprons, etc. And I just wanted to reassure you that that is no longer an issue, and as an organisation we've secured more than adequate PPE to provide support throughout the rest of this winter. So that's just for a bit of peace of mind. I'm just going to pass back to Emma now, who's going to talk to you about our staffing arrangements.
Thank you. And I think it's worth saying all of the precautions that you've outlined have to date been successful. So in our client portfolio, we've only seen one case in a portfolio of nearly 400 clients. So we really feel that actually these measures are working, so to be maintained. So because of the nature of the work, a proportion of our carers are based overseas and will travel over for their shift and then travel back to their respective countries. So at present, a number of carers from countries where they're required to quarantine on arrival in the UK for 14 days are still working for us. And we'll admit this has been a really tricky issue, and one that we've thought long and hard about how to handle, because so many of our clients are reliant on these carers and they've built up good relationships with these carers and don't want to lose them. So we've sought guidance from Public Health England and from the UK Home Care Association, and it's now our policy that in circumstances where it's the client's preference, the carer who requires quarantining will isolate at the client's property and will in effect complete their quarantine whilst they're at work. And we know that that's not an arrangement that suits everybody, but it suits some of our clients. But we have in every case discussed the options fully with the client, and of course where it would be a client's preference that an alternative arrangement was made, we would and have supported this. We've also been communicating regular public health guidance to our carers, as Hannah mentioned, which they've been following to the letter. So all of our carers, whether they're based in the UK or overseas, have been social distancing during their time off. They've been wearing face coverings, many of them for far longer than it's been mandatory to, and have been practicing excellent hand hygiene. In terms of our staffing arrangements, it's worth saying we employ over 980 professional carers directly, which means that we can plan for and sort of guarantee cover. So we are not an agency, which means that we're not reliant on carers telling us when they may or may not be available that day. We know who's available and our carers are working for us solely. We also have a dedicated rapid response team on standby for emergencies, and they step in last minute if, for example, a carer is unwell or their train is cancelled, for example, And in the 11 years that we've been running, we've never left anybody without care because we have these arrangements in place. It's both fortunate and unfortunate, but research has confirmed that home care workers are at no greater risk of getting and therefore transmitting COVID-19 than the general population. So whilst that's reassuring to some degree, it does mean that routine testing is not currently available for our carers. So we are presently exploring opportunities for private testing arrangements, although we also understand that testing at airports is likely to be available soon, which is encouraging. So testing is quite a hot topic and something that our clients often ask us about. So we are, as we say, exploring options in the hope that we will soon be able to test our carers before they arrive at placement. Currently, the only testing available for carers is the same as it is in the general population, and that's that you can request a test if you are displaying symptoms or have been in contact with someone with COVID-19. And as Hannah touched on, in preparing for the challenges this winter, we've taken real care to ensure that carer well-being is considered. So we know that winter can be a less happy time for some of us, generally with shorter days, darker evenings and mornings, and live-in care can be isolating. So all of our carers have a dedicated care manager, and our care managers tend to have smaller portfolios of carers and clients to manage than other providers, which means that they can have a more closer relationship and better oversight of the carers that they're working with. Our carers can also reach us at the Good Care Group 24/7, 365 days a year. I nearly said a week, that would be a very long week. And they have access to an employee assist line, which offers support on a range of issues, both professional and personal. Hannah also touched on the technology that we have, but we have forums, online forums, which enable carers to connect with one another. They have special interest groups, which they use to exchange recipes, tips, and generally chit-chat about their experiences. And I think during the pandemic, that's been really useful in both enabling carers to speak to their loved ones, but also for clients to be able to speak to their loved ones. So we've extended our video conferencing facilities, which enables clients to speak to people. During COVID-19, we've increased the wellbeing offer for our carers. The carers have had free access, to example, to exercise programs, Rosemary Connolly personal program and activity plans, and they've had a range of ideas of things to do that they can engage their client in despite them not being able to leave the house as frequently. And lastly, this year, anyone working in adult social care is eligible for a free flu vaccine, and we're asking our carers to get theirs now. So we're also running a 6-week communication campaign reminding them how to minimise the risk of all of winter's usual infections, as well as COVID. So in terms of tips for staying well this winter, it's worth saying that when we're talking about infections, we're talking about a whole range of infections. So we've got chest infections, pneumonia, urinary tract infections, as well as the obvious COVID. But good infection control practices for all of those infections will also minimise the risk of COVID. So there is a school of thought that says flu will be less prevalent this year than normal because we've all become so accustomed to better infection control practices. So for you or your loved ones, we would strongly encourage anybody eligible to get their flu vaccine early. The criteria for eligibility has broadened this year. You can find the full list on the NHS website, but even the age bracket has expanded this year. So anybody between the ages of 50 to 64 is also eligible for the first time. And of course, you can pay for it if you're not eligible for a free flu vaccine. It is advisable to get your flu vaccine before the peak. So do get it booked in now if you can. particularly as GP surgeries and I believe pharmacies are overwhelmed with appointments and with demand. So the sooner you can get that arranged, the better. And then whilst it's possibly the most basic method, the best way to prevent the spread of infection is to practice good hand hygiene. So as we tell our carers, we would encourage anyone in the general population, wash your hands for at least 20 seconds regularly. And that includes on arrival at other people's homes, before coming into contact with others, before and after eating, or using public transport if you have to. As Hannah said, it's really important to keep surfaces regularly disinfected, just with household products, but much more regularly than you would usually. And for people at risk of infections, there's lots of preventative measures that you can take to sort of keep well and healthy over the winter. So it's really important to stay hydrated. And we say to aim for between 6 to 8 glasses of water a day. And we give our carers sort of tips on supporting people who might be reluctant to drink. So you can always try foods high in moisture content, including custard, jelly, watermelon, yogurt. They will all contribute to good fluid intake. If somebody is reluctant or perhaps confused or disorientated by the idea of drinking, you could try more creative ways to encourage them. So drinking from a wine glass or a teacup, if that's sort of their preference, or it makes a more of an occasion of drinking. Sometimes if you cheers somebody, it encourages them to have a drink. It's also recommended to eat sort of infection-fighting foods. So the saying, an apple a day keeps the doctor away, is not just a saying. Plenty of fruit and veg will help keep you healthier and will boost your immune system. There's lots of other infection-fighting foods like garlic, fennel, citrus fruit, and ginger and honey. It's really important to keep warm as possible as we can in this country. So those with health conditions such as heart or lung disease, people over the age of 65 are recommended to heat their home to at least 18 degrees Celsius. And actually, when keeping warm, it's recommended to wear several layers of clothing rather than just one chunky layer. The clothes made from cotton, wool, or fleecy fibres help to maintain body heat, particularly important for people who are less mobile and active. Having at least one hot meal a day and regular hot drinks is recommended. And as we said, meals consisting of plenty of fruit and veg. We'd also recommend staying active, so trying not to sit still for more than an hour or so, getting up, stretching, having a walk around, participating in moderate exercise as far as that's possible. And with our clients, we talk about moderate exercise, you know, at whatever level the person is able to participate. So that might be taking the stairs a couple of times a day. It might be marching on the spot. There's a whole wealth of YouTube videos that can be followed, but you know, only exercising to your level of ability. There's actually research that says even taking 10 deep breaths can significantly reduce the risk of developing a chest infection. So for people who may be less mobile or who even are bedbound, even just taking 10 deep breaths can help. Similarly, too much lying down can increase the chance of infection because lungs aren't cleared properly. So if you or your loved one is bedbound, we'd encourage them to sleep with their heads slightly elevated and sort of move their arms and legs throughout the day if possible. It's important to identify high-risk groups. So as we've said, older people, people who are less mobile, perhaps living with a condition such as COPD, asthma, or other respiratory illnesses are more likely to develop infections. People with catheters are also more likely to develop urinary tract infections. We'd recommend speaking to your or your loved one's GP about just in case antibiotics. So these are particularly useful for people who experience repeat infections. So if you are or know someone who gets repeat infections, the doctor or the GP can prescribe antibiotics that are kept in the house and only taken if you or your loved one develops a certain set of symptoms. So usually you are aware of these symptoms, you telephone the GP, and they verbally confirm, yes, please start the course of antibiotics. And the benefit of this arrangement is that they can be started out of hours or over the holidays, perhaps when we're thinking about Christmas and the bank holiday weekends. It avoids the need for delay or for emergency input or hospital admissions. Lastly, all of our carers at the Good Care Group are trained on the use of urine dipsticks, which, as far as we know, no other live-in care provider is doing. But for you and your loved ones, it's worth saying that urine dipsticks or urinalysis can be purchased at pharmacies or online, even on Amazon, and used at home. And what they do is indicate whether a UTI or urinary tract infection may be present. So you'll still have to go to a GP or speak to a GP about a diagnosis, but these really aids the process, as you can give better quality of information. So they are literally strips that you dip into a person's urine, and it indicates whether there's all sorts of nasty things in there that shouldn't be in there. So if you or your loved one is someone that experiences regular UTIs, it helps to confirm or deny that they are likely to have a urine infection. And having a box of testing strips can be really useful. And they're really cheap, very easy to use. So we hope that this has been useful for you today.
If you need any further information, or you'd like to pick our brains about anything else winter or COVID related, you're more than welcome to get in touch. It would be a pleasure to hear from you. Have a lovely evening, everybody.